I'm
Uh,
Stefan Swartling Peterson. I'm a public health physician and professor of global transformation for health at Karolinska Institute in Sweden. I also advise UNICEF on health matters.
that's great. Thank you very much, Stefan, and welcome everybody to our first interview on personalized prevention from the Prophet Project. I'm very happy to be here today with Stefan Peterson, and we have quite a lot of interesting topics to discuss. So let's just jump into it. I'm very excited to be with you here today. So let's start with providing a little bit of a context and background to what we're going to be talking about. What does personalized prevention mean exactly?
Thank you. In fact, when the Prophet team met for the first time in Rome 4 years ago, that was one of the questions. So we came up with a definition, which is on a slide. Can we look at it?
Yeah, of course.
Now, it's a long slide. Let's talk through it here. And it's also technical language. But it says personalized prevention aims to prevent the onset of disease, the progression of disease, and the recurrence of disease coming back through the adoption of targeted interventions, not any intervention, a targeted intervention that considers different types of information. And it considers information which can be biological, a blood test, a genetic test, blood pressure, age, etc. But it can also consider my socioeconomics. How am I trained? Am I rich? Am I poor? Where do I work? And it can also look at where do I live? Do I live in a poor neighborhood, a rich neighborhood, etc.? So it's about a data-based approach to helping individuals realize using information about who they are, how old they are, how some of their biological parameters are, their weight, their height, their age, but also their education, whether they're rich and poor, and where they live. And from that, making useful decisions on how you can prevent disease, how can you stop disease from progressing or coming back.
Hmm. And how is this data collected? Is it something from, for example, your general practitioner, or how do we collect this?
But you know, some of this data is available in healthcare, but others is outside healthcare. And I think my next slide actually helps us to discuss because most of us actually start out healthy over on the left, if you look at the bottom x-axis. Then we may develop some kind of risk factor, and then we get sick over on the right. And by the time we are sick, we usually go to health services and we are called patients. And the doctor and the nurse, they take laboratory tests, they take x-rays, etc. And they use that information on us. But the trick is for prevention is that then you're not a patient. And most people who feel very healthy over on the left, they don't go to health services. They're not with the doctor. But yet they do all sorts of things that affect their health. They can be smoking, they can be physically active, they can be inactive, they can have a bad diet or a good diet, they can live in a poor neighborhood, a good neighborhood which has dirty air or clean air, or where everyone else is poor, etc. And that data over on the left, when we are still healthy, is usually not collected, or at least even if it's collected by my phone, but it is not connected to my blood pressure and to my genetic information, etc. And no one ever considers the neighborhood you live in. So this data issue, we want to be data-based and evidence-based, but all the information is not in the right place at the right time, particularly for people who don't go to health services, right? because they're healthy, they are young, they are poor, they don't have access, etc.
Indeed, yes. So what I'm seeing here is that we really need a very holistic approach in order to get to a very efficient, let's say, personalized prevention. And if there's really no place where all of this data is connected, and I think you're absolutely right, by the way, that only when it's already quite bad do we go to the proper doctors and to a hospital, and then we usually lack the data necessary to make a proper assessment. We go there
Yeah.
as if we're going, to the fortune teller, and we're saying, "Oh, I've been sick in the last more or less week. I'm not sure, and I'm not sure about this," and so on. Whereas if we manage to provide sufficient data and say, "Hey, my fever was this on these days. My blood pressure was this," I think it would be
But
quite easier to make
But
a decision.
Borislava, if you take myself as an example, I went to the doctor and they checked my blood and they said that your blood lipids are a bit too high, Stefan. That's a risk factor for you getting a heart attack in the future. We
Mhm.
would like you to lower the blood lipids. So I tried diet and it only helped partly. And then they said, you need medicine as well. So now I go back to the doctor every year and check my blood lipids, and they give me new drugs, right?
Mhm.
But not even then, when I'm with the doctor, do they measure my weight, don't even take my. Sometimes, even when you're with health services, we don't look at enough information to give me
Yeah.
personalized advice. I give the same advice as everyone else. But in fact, maybe they should ask me, what do you like to do? How do you eat, Stefan? A dietitian can give me a personalized diet advice.
Mm.
Someone can say, oh, you had a knee injury. Maybe running is not good for you, then is swimming better? And you can get personalized advice on physical activity.
Mhm.
Um, and similarly, knowing if I live in a poor neighborhood or a rich neighborhood can also contribute information. So there is a lot of information that we can use in health services, but ideally even outside health services to target
Mm.
individuals with personalized messages. And the commercial people do it very well. They send me things on my phone saying, why don't you buy this or that? Which sometimes I say, how do I know that I'm looking for this or that? I'm sure we all had that experience. That's
Yes.
because they personalize their messaging to me. Uh, and why don't we do that as health people even before we are patients, right?
Absolutely agreed. If it's possible, and obviously it is possible to have a
Mm.
very personalized advertisement on your phone, then it should be also possible to have very personalized prevention plans for all of us. And I fully agree with what you're saying, that it's not only when you go to the hospital eventually, because whether we like it or not, at a certain point in our lives, we're all patients, but it doesn't need to get to that point for us to
No.
be taken to take seriously prevention in our
True.
lives.
And we should become patients later in life. That's the point, isn't it?
Ideally, yes, that would be great.
Well,
Even
I mean,
thinking,
I may hope to die healthy, but realistically, I will be a patient before I die. But
of
for
course.
me as an individual and for society as a whole, it's much better the later I become a patient if I delay disease.
Absolutely. And in general, I feel like because there's also I'm a patient myself. I have 3 kidney transplantations, and it's been quite difficult to manage my condition as I grow up because I was born with this. It's not something that I developed
Mm,
over time. And I can definitely say that it's this aspect is quite missing in healthcare because originally I'm from Bulgaria. Currently, I live in Belgium. So I've seen quite a few healthcare systems, and I can
mm.
say that this aspect is missing generally in Europe, I feel like, because it's something that there is a lack of communication even between specialists when we think about it. Because as I was growing up, they were so focused on my kidneys and my, renal function and so on, that everything else was kind of missed as I was growing up. And for example, I didn't have the vaccines that are necessary to prevent HPV, which is in the future preventing cancer. So it's something that is definitely necessary to be informed about. It's something that is necessary to be looked after. Obviously, I wasn't going to a gynecologist when I was 11 or 12 years old. So, of course, this had to come from a different place. Again, there is a lack of communication, there is a lack of information, and somehow we need to really get this all together for just the better future of humanity at the end of the day. So indeed, what do you think is a relevant next step to make this happen?
No, I think it's about, on the one hand, realizing that healthcare might be important, but healthcare is mostly sick care. And across Europe, in the Profit project, we have looked at healthcare budgets, and they tend to spend 97% on curing people who are sick and 3% on prevention. So we need more money for prevention, but we also need more actors to work together, because healthcare cannot solve prevention alone. We need to work with the food system. We need to change food environments, how food is being displaced and advertised. We need to change our cities so its physical activity is easier, active transport, bicycling, etc. And we need to make sure that we target communities that are very sick. Many cities have differences in life expectancy within the same city and neighborhoods of up to 7 years. And that's because the socioeconomic aspect of that neighborhood is bad, right? What can we do to revive neighborhoods to actually reduce these differences in life expectancy? And some of those interventions are not with individual people. They are at the city level. Maybe they are at the neighborhood level. And some of them are at the food environment level. How do we advertise food? Which advertisements are allowed, etc. Some of this can be done at city level. Other things like sugar tax on the sugary drinks that make us overweight in Europe and across the world needs to be decided at national level. So many sectors need to work together, and we need to invest properly in prevention.
So yeah, indeed, it's something that needs to happen much more holistically. And in your experience, do you know of a good case for this type of information being involved already in a school level? Because I feel it's something that can kind of transfer the information in a much simpler way and early on, which is, I think, quite important as well.
Well, I think, and I may be mistaken, but Latin America is leading now in terms of making neighborhoods healthy and banning the selling of sweets around schools, for instance. Other places now don't let parents drive their kids to school, but they actually make it a walking zone and make it easy to move on. So there are initiatives, and they're not necessarily in Europe. Latin America would be a leader I would look at here.
That's great. That's a great example. Thank you for sharing. I'm just wondering what else can be involved in this change, let's say, because okay, for example, we have the different neighborhoods. So this is very much also, I feel like a political influence and a political decision that needs to be made eventually for the better health education of all generations, because the fact that already there is an aging generation that maybe is not fully familiar with this type of information doesn't mean it's a lost cause. Change can happen at any moment. It doesn't need to happen from the start. Any small change incorporated is important, right?
No, I think people need to know. And there is also in my home country, Sweden, good evidence now that calling people at 60 years of age and 70 years of age to look at their risk profile across these different data domains and saying this is what is an individual advice to you is actually a very cost-effective measure. So there are things you can do around health literacy in schools, later up in life through health services. But I think a lot of this is also about regulation, for instance. Which kind of commercials are we allowing? Norway is now banning commercials of dangerous foodstuffs to children. And some of it is around taxation and the United Kingdom, for instance, now has a levy on sugary drinks above a certain sugar content. You pay more tax, which actually means that sodas are less sweet in the United Kingdom now because of that levy than they are in Sweden. So there are ways that we can go about it at group level, at national level, through taxation and regulation, and not just put the whole responsibility on the individual. To me, the right choices must be the easy choices.
Indeed, that's a very good saying, and I very much agree with this because I feel there's a certain type of let's call it stigma that once you say, okay, I'm going to live healthy from now on, it means that you're not allowed at all to make any different change that is not a healthy change, which I think is very unrealistic and leads to even more regression in the future. So I feel it's important to say something I heard recently, which really made me think, is that the only good workout that you had is the one that you didn't do. So even if it's 5 minutes of just, dancing around or moving around or something like this, even the smallest change can really support you in being
Yes,
healthier in
and
your life.
there is a good evidence base that for the people who are very physically inactive, even 5-10 minutes per day it makes a big difference, and it can be walking up the stairs rather than taking the elevator. It's as easy as that.
Indeed, small, efficient, but doable changes. Because I
Yeah.
know that we've all seen on social media these influencers who say, oh, I get up at 5 a.m. and I go to the gym for 2 hours and then I do this and this.
Ah,
Highly
I
unrealistic.
wonder. I wonder if they're actually taking it if that is serious. Personally, I have a rule that I don't walk up. I don't ride elevators. I walk upstairs, and that helps me to get the exercise in my daily job.
That's great. That's great. And of course, if you live in a city that is well equipped, let's say, you can also walk to work or bike to work, and instead of taking
Yeah,
a metro or a car or something
yeah.
like this.
But if
Um,
there's one important thing, it's the food and the diet. And even there, I think we need help because for me, I eat the food that is being served in the
yeah.
canteen, for instance, right? So who makes the decisions about the food that is served in the canteen and whether that is healthy or not?
Indeed, and especially for children, as you mentioned earlier, I think it's a very key decision that needs to be made. But unfortunately, most times I feel like it's very much based on a national level decision making, even if it's influenced to a certain degree in some European regulation. If we're talking about Europe, I think it's still something that is very much
Mm.
being decided on a national level, unfortunately. And I can see quite a big difference between Eastern and Western Europe, for example. And I'm very lucky to be living in a city where I can walk to to my office, for example, 20 minutes
Mm.
walk. That's a great way to really start the day. And I'm sure that it doesn't make, such a huge difference, but over time, I'm sure it accumulates, and I can already see that it's, making me feel better. And that's
It
that's
makes a big
definitely a
difference,
plus.
believe me. The research just came out.
Really, that's
Yeah.
great to hear. That's great to
Should
hear.
we move on?
Of course, of course. Let's move to the next thing. What are the potential benefits of having a very personalized prevention?
I think just as we have personalized advertisements showing up in our phones, the added value of personalized prevention messaging is that it's more likely that we will follow that advice. If you have a bad knee, it's terrible to tell you to go jogging, isn't it? You need a personalized message. And so I think that it has effectiveness advantages. And at societal level, what we are hoping to achieve then is that we can have better, more effective prevention so that we stay healthy longer until we become patients. And that will save our societies both money, but also prevent our health services and social services from collapsing, because the European population is getting old. And if we get sick in these common chronic disorders, the diabetes, the hypertension, heart attacks, dementias, etc., at the same rate as we're doing now, our health and social services will collapse in the coming decades. So we need to stay healthier longer.
Indeed, indeed, I agree, especially with the medical professional shortages that we're facing in every country, as far as I know. It's really getting to a point where we need to consider, even if something does
Mm.
happen to us, how am I going to go about it?
Mm.
So very, very true. And what are the challenges in implementing this?
Well, personalized prevention, we have made a lot of progress, and the Prophet project shows this, that we have many genetic tests now that can look for diseases taking a genetic test. However, we don't have good personalized strategies that actually take care of all the other types of data: how I eat, where I live, how I should move, etc. And just as someone can tell me right now that my blood pressure is high, you should take blood pressure medicine. That's a test and a treatment. It's not sure that I will take the blood pressure medicine. And telling me that your gene shows that you should be taking this drug or be doing that, is that any better than telling me that my blood pressure is this or that, or my blood lipids are this and that? It didn't change my eating last time. So the challenge is actually translating this into something that makes a difference.
Mm. Where do you think it should come from for people to listen?
Well, I think it's important that we actually use health services for what they are good for, and people have trust in health services. So if we can make health services give personalized advice for prevention, including genetic tests, omic tests, in addition to assessing my diet and my physical activity, my drinking and smoking and so on, then I think it's very good. We need for that, most health systems need to be adapted for that. We need to start paying primary health care to do that, etc. So there's a whole range of challenges there that we have looked at in the Prophet project. Going beyond the Prophet project, though, is for the people who are not going to health services, who are healthy, who are going about their lives, but who are not eating a good diet, who are not doing good physical activity, drinking too much, smoking, or whatever it is, who are living in a poor neighborhood. Those we have not figured out what to do. And certainly, health sector is not necessarily the sector to solve that. We need to work with other sectors.
Indeed, indeed. If we can't reach them with health services, maybe a social approach would be more efficient in this case. But again, it's very, I think it varies quite a lot from country to country as well. For example, you said you're based in Sweden, is that right?
Correct.
Yes, and then I'm just wondering, in Sweden, do you have, for example, something like reminders or something similar sent by your general practitioner for vaccines that are, for example, time due in some time for you or something like this?
Yes, we do. Uh,
Mm.
and the phone reminds me that my daughter should go to the dentist too.
That's great. That's really great because I think that this kind of easy access to the individual is something that definitely would make a difference. Yeah. So you mentioned already a few times the focus of the Prophet project, but can you explain a bit further what are the main objectives of the project?
Well, the idea of the Prophet project is to figure out how prevention messages can be personalized. to you, to me, and to someone else. Well, the Prophet Project has looked at one aspect of personalized prevention. It has not looked at food, it has not looked at physical environment or social environment, etc. It has looked at diagnostic tests and how we can use them in health services. And we looked at which diagnostic tests that can predict risk for these chronic diseases are available, and most of them are genomic tests. There are a few others. So we have looked for tests. We have also developed a way to test, to examine whether this test is useful or not, and whether we think it should be part of health services or not. And then we have looked at how can this happen in one or two or three different European countries. What will it take? Training doctors, explaining to the general population how we can pay for these services, etc. So the idea has to be and has been of Prophet, on the one hand, to give a big framing of what would prevention look like, what we have discussed before here today, but then to focus in what can happen in health services. So it's a subset of prevention, and it can be very important for people who have genetic disease in their families, or maybe not aware, etc., to be able to test for that. So it has helped to advance that field.
That's great. And the genetic tests, are they made specifically for people who suspect genetic predisposition for a certain condition?
No, some tests are like that for specific diseases, and other tests called polygenic risk scores. They look at so many different genes and saying all of these genes together, are they predicting the risk for me to get a heart attack, diabetes, or dementia? What we have found is that those polygenic tests are not yet so effective in predicting risk. It's actually more important to ask people the usual lifestyle questions. Are you smoking or drinking? Are you happy or sad? Do you have a family around you? Than to take those polygenic risk tests at this time.
I think that's a very positive message, because then it seems that even if there is a chance for you to develop something, the way that you live and the choices that you make can really make an impact on how it develops over time.
Yes, and when we look at the literature, the genetic, even if you have bad genes, the risk of certain diseases can go up by 20%. But if you live a bad lifestyle, eat and badly, don't move, smoke, drink, etc., your risk goes up 80%. And even if you have bad genes, does this research show, if you live a good and healthy life, you can compensate for the bad genes. So with regards to risk for the common chronic diseases, cancers, diabetes, heart attacks, etc.
That's very interesting, and I think it's a very good takeaway message, let's say for our viewers, to know that your choices matter more than we think at the end of the
Yes,
day.
they do. But I think the other message is that it's not necessarily just your choices. We need to ask our governments to make the right choices, the easy choices. So it's not just only the individual, but it's also our governments, our municipalities, and our surroundings that we need to put demands on, so that we have a right to a healthy diet, we have a right to clean air, we have a right to a city planning that allows us to move actively.
I think that's also very important as well. There is a bit of a silly saying that is, do you want this orange? And you're like, no, I don't want it. But then what if I peel it for you? Yes, okay, I will take it. So it's also very much necessary for the choice that we want to take to be made easy for us to take the healthy choice. Of course, you can just take a chocolate bar, eat it like this. But then if you have something that is pre-cut ready, it's also very much an easy choice for you to do. So very, very important. Thank you very much for this conversation. I think that was our last question, if I'm not mistaken. Yes. Oh, just a second. Yes, okay, we're still here.
Okay.
We're here.
Thank you,
Thank you very
Borislava.
much.